Hello, I am Allison Payne. I'm an associate professor in the Department of Radiology and Imaging Sciences at the University of Utah, and I am happy to present our work today on a new skin cooling system that we have developed for body MR-guided focused ultrasound treatments. When you're doing thermal ablation treatments with MR-guided FUS, if you have repeated exposure, particularly in the near and far field interfaces, this can result in undesired heat accumulation. And large tumors or targets that are particularly close to the skin are the most susceptible to this heat accumulation. And this can cause skin burn. So if you have a forced convective cooling device, this can potentially protect the skin without compromising your treatment's efficacy. So this work has been developing a conformable skin cooling system. Now, we wanted this to be compatible with body MR-guided focused ultrasound systems in a fairly vendor agnostic way. So our design requirements are, of course, MR compatibility. It had to be acoustically transparent and not impact the treatment. It had to be conformable to numerous types of anatomies. And it also had to maintain the skin temperature at a desired cool level. So we put these together and developed a forced convective cooling device. It has user-specified controls, specifically the pad temperature as well as the coolant, the pad pressure and the coolant temperature. So it has three main components. The first is a cart that's actually sited in the MR control room, and this contains the pump and water reservoirs that you need for the skin cooling system. The second component is a control box that is placed on the MR console, next to the MR console and focused ultrasound console for ease for the operator. And this is where you set your pressure and temperature control and you control the whole system. And finally, the portion that interacts with the patient is the skin cooling pillow assembly. This is the part that is on the MR table. There are insulated supply tubes that are routed through the waveguide that are interfaced with the connectors here. So to evaluate the design requirement of acoustic transparency, we developed a small scale, about a 12 centimeter diameter skin cooling pillow. And we evaluated this with scanning hydrophone measurements. And what we found when we evaluated three conditions, specifically a water only, when we had a skin cooling pad without any baffles or channels, and then a skin cooling pad as seen here with these channels welded in. With the channels, we had about a 12% reduction in peak pressure with a 5% reduction with no channels. And interestingly, there was no aberration of beam size. And so we deemed this to be effective for acoustic transparency. We also wanted to evaluate the flow effects. The cooling fluid through the pad is just distilled deionized water. It's not doped with salts or anything else in any way. And so we took a full-size skin cooling pillow and we placed it underneath a homogeneous gelatin phantom, and we had a single MRI receive coil around the phantom. And we evaluated this under flow conditions as well as when there was no flow, when the fluid in the skin cooling pillow was completely still. And so what we did is we did single sonications under both conditions. This was at 0.5 milliliters per minute, and we maintained a 5-degree centigrade coolant temperature. And as you can see in the flow on and off conditions, there was no significant difference in temperature accuracy or precision. Indeed, when you look at the spatial patterns, there's no beam aberration with flow off or on, and it doesn't seem to interact with the temperatures here, even in the flow on conditions through a sagittal slice in the phantom, where these white lines are showing the location of the skin cooling pillow. To evaluate conformability, we took the skin cooling pillow and we placed it beneath a healthy volunteer at different anatomies, and we wanted to evaluate acoustic coupling and how it conformed to the body. So we evaluated this in the posterior knee. We did it inferior to the clavicle. We also did the abdomen as well as under the upper thigh. And in all cases, there was adequate acoustic coupling shown in all cases. And importantly, there was no bubble formation during the testing as well. So finally, we evaluated this in an in vivo setting. So in this, we did it in a porcine model. So we tested this in 3 farm pigs. And what we did is we tested it under 2 conditions. where we had the pig lying on its side, so its haunch was just directly over the skin cooling pillow, as well as the control condition where we had nothing. And in each thigh, we took and we sonicated 4 individual matrices, where each of these cells had 9 individual sonications. And in the first 2, we had a 10 millimeter distance from the skin, and the second, we had a 5 millimeter distance. So shown here are the results for the control side, where there was no skin cooling pillow in place, as well as the cooling side. And you can see the cumulative thermal dose overlaid on this T2 weighted image. And this table here shows for each sonication what the volume was that we were able to ablate with the control on the skin cooling pad. Now, the most important thing is, where did we have marks or burns on the skin? So the single asterisk indicates where there was a mark, a red mark that eventually went away, as well as the double asterisk is where there was a permanent burn. And as you can see, vast reduction when the skin cooling pad was used for both marks and burns on the skin. So to conclude, we have presented a vendor agnostic skin cooling device that met our design requirements as outlined earlier. So this reduced or eliminated skin burns as close as 5 millimeters to the skin. There is no impact on MR temperature imaging, precision, or accuracy, and this has been utilized clinically in both fibroid and desmoid tumor treatments. Now, patients under these treatments, while a rigorous evaluation hasn't been done, they appear to be more tolerant of the higher energies, and they're able to treat closer to the skin without burns. And of course, future work will more rigorously evaluate the clinical performance. So to conclude, I just want to state that this is an open source design. I point you to this GitHub link where you can find all the design plans, parts, and the schematics available. I'd like to thank my co-authors, particularly Rob Merrill, who was the main engineer in this effort, and also note that this was funded by the Focused Ultrasound Foundation. Thank you very much.